Here we go. Welcome to the How to Health podcast. I'm Dr. Lori Marbus, and today I'm honored to have Dr. Angie Sadeghi. How are you today?
I'm doing very well. Thank you for having me.
Oh, well, thank you for taking the time out of your day to tell us your amazing story and also what you do as a specialist, as a gastroenterologist. I mean, there's so much information here. I just can't wait to pry out of your brain. But I want to hear about your story because I know that was life-changing and life-altering for you, and how you came about it was almost happenstance. So can you just kind of tell us a little bit about your story and how you came to a plant-based diet or even medicine in general?
Absolutely. You know, Lori, when about 4 years ago, I was extremely ill. And people who know me, they know that I was suffering from debilitating eczema. I had pustules on the palms of my hands, all over my body. And since I was very, very young, I think I was 13 when I got diagnosed with eczema, I had been applying all kinds of corticosteroids on my skin every single night. I had to medicate myself to sleep with Benadryl every single night. Otherwise, I'd be itching all night. I probably got poor quality of sleep most of my life because of that eczema. I had been to several different doctors, and all I would get is either prednisone pills or prednisone or corticosteroid creams or Atarax, which is a medication for itching, and Benadryl. So that was my routine every single day. And of course, I was embarrassed to shake people's hands because of my pustules, because even though I would put the corticosteroid creams, it would still come back. Besides the skin problems, which were quite embarrassing, I was overweight and my cholesterol was high. And I remember when my OBGYN, when I was pregnant with my son, when she told me that my cholesterol was high, I was shocked. But then I was like, well, I guess it's genetic because my father went on cholesterol medicines when he was 40. And I thought, well, I'm right around the corner from that. And I guess, I got his bad genetics. What can I do about that, And I was eating the standard American diet, thinking I'm doing everything right, And so then the other issue was that I was extremely tired. Every morning, I would have to force myself out of bed, and I felt like I was hit by a Mack truck. I was so exhausted and tired, and I would say borderline depressed and people who know me right now, they would be like, what, you were depressed? And it's like hard to believe. But, I would never kill myself. However, if I just didn't wake up one day, it would be okay, kind of type of a life. And so I just was dragging myself to work every day. And literally I would, after a little bit of a drive, 17-mile drive to USC where I was doing my residency, I would actually have to sleep in the car for a half hour before I could get out of the car and go to work because I would be exhausted from that 17-mile drive. And so I thought, well, it's just the pressures of residency. I mean, who knows? I mean, I never thought in a billion years that all of these problems could have anything to do with my diet. And at the time, I was basically actually a vegetarian. I'd given up eating meat for several years for moral reasons, but I didn't know the bad effects and the side effects of eating dairy. And so I was eating a lot of cheese because I was one of those vegetarians who substituted a lot of cheese and other animal products to compensate for my protein. Because at that point, I had very little knowledge of nutrition. So I was at a conference one day, my brother's conference. It's called the Titanium Success. And while he was on stage, it was May 2014, he said something about, well, if you're trying to lose weight, what are you doing drinking milk and eating cheese, people? It's just like a block of fat, and cheese is just a block of fat, and milk is just sugar, water, and fat. So, if you're trying to lose weight, just saying you may not want to eat all that stuff. And I thought, well, I was overweight and I wanted to lose weight. And I thought, oh my gosh, I need to stop eating this stuff. And that same day, at the end of the seminar, I was talking to my cousin, who's a vegan, who's a musician in Hollywood. Her name is Masa. I was like, hey, Masa, I'm so glad, you told me several years ago that you went vegan. I've been vegetarian, and you motivated me because I haven't been eating animals for so many years. He's like, she said, well, to be honest with you, if you really want to do it for moral reasons, you shouldn't be eating dairy because the dairy industry is far more cruel to the animals than the meat industry. So I thought, here I am sick. I want to lose weight. And I was not eating meat for moral reasons, and I can't eat dairy for moral reasons either. So then that day, I went full plant-based. And I didn't even know what it's called. I went vegan because I didn't know that there's such thing as a whole food plant-based diet. But at the very end of her sentence, she said the most important thing that I could have heard. She says, as a doctor, you should really check out Forks Over Knives. I was like, what's that? She said, oh, it's a really great documentary. I think you'll like it. I was like, okay, where would I check this out? She said, it's on Netflix. I was like, okay. So that night, I went home and I checked out Forks Over Knives. And my reaction was awesome. I wish there was a video camera on my face. I was like, my jaw dropped as I was looking at, when Dr. Isselstein was talking about coronary artery disease reversal. And as you know, in medical school and in residency, we were taught that you can't reverse coronary artery disease. And, once you have it, you have it. Good luck. Take some statins, take some aspirin, take this and that, like 50 medicines, and good luck. And I thought, oh my God, what is this? I've never heard of this. And I was so enlightened. I was so motivated that I was like, not only am I going to eat a whole food plant-based diet, this is going to change my patient's life. I was so motivated that as of that day, I was like, I'm going to spread the news. Because, I was changing my habits for moral reasons, but as a physician, I never thought that I should talk about moral reasons in the clinic. But now it was like, wait a minute, not only am I not helping the animals, it's like, not only am I helping the animals, it's like I'm making people healthier by the minute by teaching them this method of reversing diabetes, reversing cholesterol and hypertension and obesity and all of that. So I was so excited. I could hardly wait. And ever since then, every single day, I don't think there's a day that goes by that I don't recommend to my patients to watch Forks Over Knives and the new one, What the Health. And there's not one single day that goes by that I don't help my patients convert to a whole food plant-based diet and to try to reverse their disease. So I think that eczema and all those illnesses that I had in the past was quite possibly the best thing that could have happened to me, because it motivated me to help people. Because now going back to my story, I stopped eating dairy, right? Because I had already stopped eating meat, but I stopped eating dairy, and suddenly these miraculous things happened. Within a week, just about a week, that's all it took, my eczema went away. The scars were still there, but there was no more itching. I was like, oh my gosh, I'm not using my Benadryl for like a few days now. Is this weird or what? So I was like, oh, it's just random, right? I didn't believe it. I was like, a month passed by and the tube of corticosteroids were sitting in my bathroom thing, and I hadn't used it. After a month, I was like, oh my God, could this have been the dairy? Because that's the only thing that I had to like give up, right?
Wow.
So my eczema cleared 100%. My sinuses got better, and my quote unquote chronic fatigue and depression went away. And I knew I was onto something, because I was like, I'm going to help so many people now, because now I know. The other things that happened is I checked my cholesterol. My total cholesterol was way over 200. It went down to like 160. Okay, so it was all the dairy that I was eating that was causing my cholesterol to go up. And another thing that happened is I've been working out my whole life. Like, whether in high school I was a swimmer, then I was an ice skater, I was always a gym buff, I was always at the gym working out, but I never saw results. It was just like I always looked like this chubby girl, and I wasn't really confident about the way I looked. And so one day I looked around and I had better abs than the trainers. I was like, whoa. I was like, man, I'm like stronger than these trainers who are training. This is fantastic. And this guy goes, you look like a fitness model. I'm like, Wow, thank you for a chubby girl who like transformed my body to look like a fitness model as a nerdy doctor. I was like, this is the best compliment in my life. I was so happy. Yeah, exactly. So it was incredible. I got so motivated because my game at the gym was getting stronger, my recovery time was getting shorter, and I've been on fire since then. My 9-year-old can't keep up with me because I have so much energy. I mean, it's incredible. I can't tell you how many good things have happened in my life. I mean, it's just incredible. So for whoever's listening, if you have any health problems and if you're tired, trust me on this. You have to give this diet a chance, and you will see some incredible things happen.
Wow, that's incredible. So how long ago was this?
So I went vegetarian about 15 years ago. However, I didn't go whole food plant-based until May of 2014 at that seminar.
So literally that short period of time, your entire life has changed in a matter of weeks to months, and now you're a whole different person, a whole different way of looking at treating patients. And
Oh, yeah,
it's highly addictive.
it is so amazing because, as you know, you and I as conventional medical doctors, we have all kinds of pills that we can play with, but how many times did you find yourself all sad because you're like, wow, every time this patient comes in, I'm just needing to add yet one more medicine to help them. And as you know, when people are on all these cholesterol medicines and blood pressure medicines, you can never get it perfect, and you'll see liver enzymes go up, and I was studying statistics about statins and how they don't really reduce your risk of a heart attack by that much. Anyway, it's like 20% risk reduction. So no matter how you look at it, these medicines can never do what a whole food plant-based diet can do to treat the problem from the underlying cause. When you're putting animal fat, when you're putting saturated fat in your body, you cannot prevent the disease by just taking a pill, because the damage is so much bigger than the benefits you could get from drugs. And that doesn't even include the side effects that you can get. And that doesn't help the gut bacteria. So you could take medicines and you could fix the blood tests, sure, if that makes you feel better, but it doesn't mean you're healthy, and it doesn't mean that your gut bacteria is not affected by the bad foods.
Right. And so that's a whole nother discussion. Is tell us, what is the important things that the gut bacteria actually do? I mean, that's such a thing that we're just now beginning to understand, at least from a primary care, physician standpoint. What would you suggest that we need to know about the gut bacteria and the microbiota that actually help us with our health?
It's all about the gut. I could be partial, but well, Lori, the way I explain it to my patients, and I know a lot of doctors are listening, but I'm just going to simplify it because I like to make things simple for me, and I'm just going to describe it like I describe it in my clinic. The gut there are trillions and trillions of bacteria, or not just bacteria, microbiome living inside our bodies from mouth to anus. What you have to remember is there's more genetics carried by the microbacterium than your entire cells combined in the body. So these little guys play a huge role in your health. And if you look at it, if you kind of just try to simplify it in your brain, what I call is the good guys and the bad guys. There are good gut bacteria, and then there are bad gut bacteria. The good guys thrive on eating fiber, right? When you eat fiber, the good guys thrive, and they populate, and they grow, and they prosper. When you eat quote-unquote bad foods, or when you eat a standard American diet, such as fatty foods and acidic foods full of meat, what you're doing is you're feeding the bad guys, the bacteroides, which are the inflammatory types. So your diet is everything, because the first, these bacteria or these microbiome are the first line that basically get the type of nutrition that you're getting. So they're affected by it. There are rat studies that show that when you eat saturated fat, within a few hours, the bacteroides type become so much more predominant, and the quote-unquote good guys are basically almost non-existent in the gut. So it's within a few hours of eating saturated fat, or mostly animal fat. So that sets off inflammation, and that sets off hardening of the arteries within hours. And so then it increases your, cholesterol, of course. But, then you can take the pills, but that's fixing the cholesterol. That's not fixing the damage that was already done as you ate that food. So, in this country, as we've become proteinaholics and worry so much about our protein, what has happened is the fiber intake has gone down. The USDA is now recommending at least 15 to 30 grams of fiber per day. And of course, as a whole food plant-based lifestyle, I get like 70 to 100 grams because that's what's healthy. But most Americans are not even getting 15 grams per day. So you can see how the gut bacteria is affected. And the majority of Americans are getting so little fiber that they're full of inflammation because what they're doing is they're feeding the inflammatory gut bacteria or the bacteroides. So there's no wonder there's so much disease. And the awareness for fiber is so low in this country. Nobody cares about fiber, and they're all worried about their protein. And as you know, no one in this country has ever died of protein deficiency. Okay, I'm exaggerating, maybe one person, but you see, we're getting way too much protein. And I'm saying that as a fitness competitor and a fitness weightlifter. I power lift. I'm very fitnessy, so and I can beat most guys in my push-up game. Okay, let me just put that bragging right in there. But what I'm saying is, I'm a very strong person, but I could care less how much protein I'm getting. I never even look at my protein content. If I were to count, I could. I'm sorry. Can you hear me? I think I lost reception. Give me 1 second. I'm going to get my charger really quick. So sorry. As an avid fitness enthusiast and as a health doctor who's interested in health, I could care less about my protein. I never count my protein. Yet every single person I ever meet, including my mom and dad, they always wonder, how much protein should I get, and where do you get your protein, and things like that. So I guess my message here is don't worry about protein because you need very minimal amounts of protein in your diet, and the whole entire nation needs to start focusing less on protein and more on fiber, because fiber is the magic bullet that travels through the gut and feeds the good gut bacteria. Which are responsible for producing what? Hormones. Most people don't know this, but 90% of serotonin, the feel-good hormone that your body needs, is actually produced by the gut. Okay, so you are what you eat. If you're eating junk, processed food, refined sugars, and saturated fat, and meat and dairy, you are feeding the bad guys, which produce inflammation, chronic fatigue, joint problems, hardening of the arteries. I can go on and on, right? Diabetes. And if you're eating fiber, what you're doing is you're feeding the good guys that are anti-inflammatory, that produce feel-good hormones. So no wonder I was depressed, right? I didn't know this back then, but now I know that it was my diet. So I guess going back, I just want to emphasize, stop worrying about your protein. And actually, if you're going to worry about any macronutrient, worry about your fiber because fiber carries micronutrients. When you eat fresh fruits and vegetables, you're getting micronutrients. And most people don't even worry about the macronutrients, but a lot of us are vitamin C deficient. So that's why a lot of people have a poor immune system. And that's because we're not eating green leafy vegetables and fruits. And as these fat diets come around, low carb, ketosis, and things like that, people are not getting enough micronutrients. So anyway, sorry to go on and on about this, but I'm very passionate about fiber, as you can tell.
No, I think it's absolutely fabulous. And so some people, though, we hear the word fiber and they think they can just take a pill, right? Or they can put some powder. But it's so different, right? Because what you described exactly is that fiber carries with it the phytonutrients that we're so desperately needing to make sure everything's working well. Can you describe what actually fiber is? Because I think there is some confusion as to what actually fiber does or what it is exactly.
So the fiber is actually a type of carbohydrate. So that's why it drives me crazy when people say, I want to eat a low carb diet. Well, don't do that because fiber is actually a macronutrient that is, there's two types, soluble and insoluble. Don't worry about that. I even, sometimes if you ask me, well, is this one soluble or insoluble? I'm like, I don't care. I eat it all, So when you look under carbohydrates, it says it's fiber and then it says sugar. what you want to do is try to figure out what has the most amount of fiber and the least amount of sugar, right? So if you have, for example, if you pick up some pasta, okay, there's some, if you pick up lentil pasta, for example, I was giving it to my son the other day, and someone said, "Oh, isn't that a lot of carbs?" I was like, let me show you something. This is not a refined carb. This is a lentil pasta. So if you look over here, there's like a bunch of fiber in here and very little sugar, right? So that's good for you. So when you look at carbohydrates, remember that carbohydrates can be good for you if it's a fiber type of carbohydrate. Fiber basically it's found in plants or vegetables, fruits, nuts, seeds, and legumes, and grains. Okay, so basically it feeds the good bacteria, of course, as I mentioned, and it also works like as a stimulant of the gut, and the details and the pathophysiology of that is being worked out, but somehow it stimulates the gut to have regular bowel movements. It lowers the cholesterol. Fiber also, like I mentioned, is usually comes along with micronutrients that slowly get absorbed through the gut as the fiber travels through. Fiber can also act as an osmotic laxative sort of a thing, if I may say so like that, because the insoluble fiber carries a lot of water with it into the colon. So if you don't have enough fiber, you get very constipated, because you need through osmosis some of the water that you're drinking to end up into the colon to give hydration to the stool. So that's why a lot of people drink tons of water and they're still constipated. It's because they're not eating enough fiber. That water, if you drank 11 liters of water, all of it gets absorbed into the small bowel. Very little, maybe a couple of hundred cc's will end up in the colon, unless you're drinking that water with foods that have fiber in it. In that case, that fiber will carry the water into the colon. Then, so that's for people who have constipation. There are people who have diarrhea, who have unhealthy bowel habits because they're not getting enough fiber. Fiber is one of those magical ingredients that actually works not only as a constipation medicine, but it also works as a diarrhea medicine because it bulks the stool. Why? Because a lot of your stool is actually made out of the bacteria, right? Over like 80% of your stool is bacteria. So when you're eating all this fiber, it's feeding the bacteria, and so that's how you bulk the stool. So it basically, if I were to say one thing about fiber, it's the regulator of the GI tract.
Okay, so that makes sense. So now you have someone who has really severe GI issues outside of irritable bowel and that stuff, but like, let's say inflammatory bowel disease, ulcerative colitis, and Crohn's. So people will tell you food has nothing to do with this. There's nothing that can make this better except medications. It's genetics. But I know I have multiple people who have, put their Crohn's and ulcerative colitis in remission eating a whole food plant-based diet. So what do you say to someone who says food has nothing to do? I've actually had someone say to me, food has nothing to do with any autoimmune disease. I said, this person is completely ignorant. So outside of that, but what do you say to someone who says that, like, food has nothing to do with these inflammatory bowel diseases? Oh, can you hear me?
Yes, you were a little bit muffled, but can you hear me?
Yeah, I can hear you.
Okay, so yeah, absolutely, food has a lot to do with it. I mean, when you look at the studies, inflammatory bowel disease is multifactorial. Yes, there are some genetic components. You have to have the genetic for it to actually occur as an acute inflammation at sometime in your life. But the question is, there are some people who have the genetic, but they never have the manifestations of the disease. And so why is it that certain people actually end up with Crohn's disease and ulcerative colitis, and some people don't, despite that both groups have the genetics? So I think most of the reasons people actually end up having acute inflammation is environmental causes. So they have the genetics, and then the environmental causes is basically what they're eating. It's the food they're eating. We know that the cause of, for example, if you study ulcerative colitis, the gut bacteria imbalance and the inflammation, it comes from the Bacteroides types, or the bad guys. That sets off inflammation, And what happens is it becomes like basically an inflammatory chain reaction where the T cells get activated, these white cells get activated, and they produce all kinds of inflammatory products. Somehow the body's like, oh, that colon is foreign, and it attacks the colon. So that becomes an autoimmune reaction, and it just doesn't know where to stop because there's inflammation that's recurring, and the body keeps reacting. So that's why it becomes a chronic inflammation. Historically, we have put people on medicines like prednisone and some very strong medicines that actually stop this chain reaction, but we've never really been able to treat diseases and put them in remission with anything other than all of these strong medicines that are supposed to take away the inflammation. Recently, when I learned about the pathophysiology and how the gut bacteria has a lot to do with ulcerative colitis, I thought, well, why don't I just put my patients on a whole food plant-based diet and see what happens? And I can tell you in one instance, for example, this lady who had pancolitis, meaning from the cecum all the way to the rectum, she had inflammation, the entire colon. She went on a whole food plant-based diet. They came back and instead of having 15 to 20 bloody bowel movements a day, she was reporting that she was actually totally fine, and she was not having any symptoms at all. And this woman, just by eating a whole food plant-based diet, but she went, now let me tell you, she went whole food plant-based overnight. She didn't cheat at all, no dairy, no meat, and she basically ate a very alkaline diet and full of fiber. And so basically she literally put herself in remission. I have another patient with Crohn's disease. He's a really, really nice guy, and he came to me, and he has several complications of Crohn's disease, really severe disease. And he told me that, I don't want to go on these heavy-duty medicines. And based on our knowledge, when people's Crohn's is that severe, you actually tend, as a doctor, you have to offer the heavy-duty medicines because the whole food plant-based diet hasn't been as tested in patients with so many manifestations of the disease. So I said, well, I wouldn't want to take medicines either, and this is what I would do. You're more than welcome to go on all these medicines, but if I were you, I would go on a whole food plant-based diet for like 2 to 3 months. I'll give you prednisone to help you. And then you stay on a whole food plant-based diet, and maybe you won't need these heavy-duty medicines. He agreed. So we helped him. I helped him a little bit with the prednisone, and he ate a whole food plant-based diet. He was doing fantastic. He basically went into remission, stayed in remission. One day he was visiting his family in Korea, and he said, doc, I just got, I had these temptations to have Korean barbecue, and I went for it, and I had it, and he came back with a full flare-up.
Wow. So,
I mean, this guy was one of those examples of someone who says, oh, maybe this was a coincidence, maybe this whole food plant-based diet, is not the reason I got better. Maybe it was the prednisone. So when he went whole food plant-based diet, again, his disease cleared. And he's one of those people who kind of cheats once in a while still, and it's like really clear. As soon as he cheats, he'll have a flare-up. So, so those people who say that inflammatory bowel disease can't be cured with a whole food plant-based diet, I would tell them, well, perhaps we need some more studies. But if I were to come down with Crohn's disease or ulcerative colitis, which will probably never happen because of my diet, but if that would happen, I would go on a whole food plant-based diet, and I would not use any medicines, and I could put myself into remission with a perfectly healthy diet full of fiber and very low fat. And I guarantee that if we were to do studies, double-blind controlled studies, that would be proven for sure.
Yeah. Exactly. It makes so much sense too. I mean, that the surface area of the gut, I mean, it must be tremendous with all the villi and everything. I mean, how much you're being exposed to your outside environment by just eating. I mean, it's tremendous. So I agree. I can't wait to post this. I can't wait. It's gonna be a great interview. One other question though. So I have lots of other questions, but this one in particular, I seem to get recurring. I have people who transition to the whole food plant-based diet. they do great for a bit, but then they start getting really gassy, and then they get bloating, and they're really uncomfortable. What do you say to those individuals, or what is the cause? What can we do to help them, move along and kind of get over those type of symptoms?
Oh, that's such a good question. I'm so glad you asked that. Basically, fiber is digested by the gut bacteria, right? So when you eat, when you don't have the gut bacteria population to digest that food, you get bloated because, so let me go back. So what do you think causes gas in the bowel, right? Bloating comes from gas in the bowel. So when you breathe air, you take a deep breath, it goes into your lungs, it doesn't go into your gut, right? So studies show maybe you swallow, I don't know, about 10 cc's of air per day, but that doesn't account for all that significant bloating people get. So then you would think, well, where is that bloating coming from? Well, it's those little guts, the guts that process the food, and they release gas, methane gas, which what makes flatulence smell bad. That's how you get burping. That's how you get CO2 and all kinds of gases in the gut. Okay, having said that, when you have excessive bloating, that means there's some kind of a maldigestion happening. Okay, something's not getting digested well, or you don't have the quote-unquote equipment to digest that food. Okay, in case of people who get bloated when they look at beans, when they tell me, you know what, I look at beans and I get bloated, I'm like, fantastic, you should eat more of it. That's fine. There are tests where you can blow in this device and it tells you, oh, you have small bowel intestinal bacterial overgrowth, blah, blah, blah. I just tell them, how much beans can you eat without getting bloated? I mean, that's exactly a good sign because beans have a lot of fiber. So as soon as they eat beans, I go, no, I can't eat beans. So in the old days, mistakenly, and still this is going on, people used to do things like the FODMAP diet. Okay, the FODMAP diet is like an elimination diet where you just look at a big list of ingredients, like especially fruits and vegetables that cause bloating, and you eliminate all of it. Okay, so all you're left with is meat. Okay, so the bloating does go away initially. Of course it goes away because you've eliminated all these foods that you couldn't digest in the first place, and your bloating goes away. But that's a bad idea because all you're doing is feeding more of the bad gut bacteria and not getting enough of the good gut bacteria. So yes, initially it's going to be painful. Okay, I agree. You have to start eating, actually going exactly the opposite way. Oh, by the way, going back, the only thing I like about the FODMAP diet, it says eliminate dairy. That I don't disagree with, okay? But everything is all the fruits and vegetables. It asks you to avoid, don't do it. So what you want to do is actually slowly do the opposite. Slowly add fiber to your diet. The way I tell people, I'm like, look, it's not rocket science here. You just add about 5 grams per week or more if you can tolerate. I mean, everyone's different. Some people can have half a can of beans and not get bloated. Some people have to have like 3 pieces of beans to get bloated. So it's just different. But if you add about, I don't know, 5-10 grams per week and slowly start increasing these foods in your diet, then that eliminates the bloating. The way I did it, I went plant-based overnight, and I thought, all right, I don't care. It just kind of was a little bit uncomfortable at the beginning, but I got healthier and healthier by the minute, to a point where, I brag to my patients, I'm like, I can eat 3 cans of beans and not get bloated now. So
Same here. I love beans. Oh my goodness.
Yes.
So you basically tell them just keep eating more fiber. And how long does that typically take for those symptoms to abate?
Interestingly, everyone's different. I think, I don't know, I've seen people 3 to 9 months. It's just so, and you always have to count also, look, if someone's 100% whole food plant-based diet and they're never cheating and they're not eating any saturated fat and they're actually the really healthy vegan people, I mean, I must admit, I even sometimes fry my food in coconut oil, and that has saturated fat. I'm sorry, my phone. So as long as you're eating 0 fat, your gut bacteria is doing fantastic. You're always on a roll and doing fantastic. Then that bloating can go away within a few weeks to a month. But if you eat anything fried, and it's almost impossible not to get any fats in your diet. But if you, like, say one day you eat too much fat, you're still going to get a little bit of an increase in your bad gut bacteria, and maybe for the next couple of days you're going to get bloated. So it just depends on how perfect you are. If the forks over knives diet, you probably would be fine within several weeks or months, and you never have to worry about the bloating. But that would mean that you'd have to follow that every single day, no cheating.
Right, exactly. So then when people, let's say they've been well and they're doing fine, and then suddenly they get, let's say, constipated, they say they're, 100% whole food plant-based, no cheating, but then they get either constipated or they start having bloating that suddenly like came out of nowhere. What do you think that is typically? Is there somewhere that they could start investigating, or should they start looking at food sensitivities, or what exactly?
Well, people who get constipated when they go whole food plant-based, they're lactose intolerant. Okay, so that's my experience. So when patients are highly lactose intolerant, I ask them to avoid dairy and go whole food plant-based. They always come back and they're like, oh my God, now I have to take laxatives. I mean, I have people who tell me, like, I used to work in a town called Poplar Bluff, Missouri, and it was 2.5 hours south of St. Louis. And they said, Doc, I know every bathroom from here to St. Louis. And I'd be like, oh my gosh, that's horrible. Okay, well, give me 1 month of your life and you're going to be fixed. And actually, one of the pharmacists over there was telling me this. I said, give me 1 month. And she said, oh, you seem so confident. I'm like, well, yeah, you're going to be fine. And she's like, what? I have like 20 vitamins a day. There's no way. I'm like, trust me. So she gave up all dairy. She came back and she was totally constipated. Okay. So at that point, well, now she was highly lactose intolerant, right? But she was still eating meat. So people eat a lot of dairy and meat. They have to realize that that meat is going to constipate them. The only reason people who are eating meat are not constipated is because they're lactose intolerant. When you eat a lot of meat, which is supposed to constipate you, there's zero fiber in meat. Just remember, it's like the unhealthiest food you can eat. Because when you eat something, remember, it has to have a lot of fiber, or you shouldn't even put it in your mouth. So meat has zero fiber. So when you eat meat, you're going to get constipated unless you're drinking milk and eating products that have lactose in it. It's sugar that our body is not designed to digest at this age. So then you get diarrhea. So that's the only reason, your body can actually have bowel movements. So when you give up the dairy, you would get constipated unless you're eating tons of vegetables or give up the meat. Okay, then that's a good balance. For someone who is basically, they go overnight whole food plant-based, it's very, very rare that they would have constipation unless it's just their gut bacteria needs building. And they stick to it and just, at first I would say take some Miralax or some kind of an osmotic laxative to help you, and within 6 to 9 months they should get better. However, I also have to emphasize on the importance of hypothyroidism in patients. Hypothyroidism is very common, and there are now studies that are coming out that show that the thyroid gland is affected by the acid foods that we're eating, meat and dairy. So that's why when I check people's T3, I've studied anti-aging medicine, and so typical conventional medicine has taught you to look at T4 and TSH. Well, I have found that in my practice, based on the anti-aging medicine that I've studied, that if the free T3 is below 3, this is the free T3, people cannot have bowel movements. And so a lot of these people end up on medicines, right? And so even if they're eating switch to a whole food plant-based diet, they can't have bowel movements on their own. And so when I fix the thyroid, suddenly they're fine, because thyroid plays an important function in your bowel habits. So don't blame the food. Your doctor has to check free T3 and make sure that it's about 3.5 and above. If it's 2.7, which I find commonly in meat eaters and people who eat the standard American diet, you're not going to be able to have a bowel movement on your own unless you're eating dairy, which gives you lactose intolerance. I know it can get really twisted, but to make a long story short, if you go whole food plant-based and you have a lot of fiber in your diet and you're still not having good bowel movements, make sure that you check your thyroid and stick to the diet, because your digestive system takes a few months to regulate.
Absolutely. Well, I've been hypothyroid for 21 years. And so that's kind of a special area that I'm super interested in. What's interesting was I grew up always constipated, right? And had GI issues like irritable bowel stuff until, I got older, then I ate less dairy. That seems to help. But when I went to a whole food plant-based diet, my thyroid dosage actually dropped. So I'm only on levothyroxine, but I've also found there are certain people, just like you described. I started checking T3 early on in my career just because There are a few individuals I would give levothyroxine and their symptoms would not improve. They just were not converting that T4 to T3.
Right.
And so that's where the Armour thyroid came in, or, you know, doing the leothyroxine, because I needed that T3 and T4 and balancing. It was really interesting to see those differences, but you're exactly right. The T3 is very important to measure. And so coming from someone, yeah, my son actually, when I was pregnant with Jonathan, who's 21 now, he actually was born hypothyroid. His test came back that he was hypothyroid. 2 weeks later, we checked it. He was okay. I was later on diagnosed about 2 months later with the hypothyroidism. So my antibodies had actually attacked him. And he's my one kid that ended up developing, learning disabilities. So, you know, he's done fabulous now, but he's also had to deal with, you know, dyslexia and some other things, which is really common. So food it's got so many repercussions, not only for my health, but my kiddo's health, his long-term, you know, I feel disability with having to deal with dyslexia and having to work harder. And there's just so many ramifications that we don't understand, that just because how I was eating growing up when I was pregnant, and then the lifelong struggle that he had to have. I mean, he's overcome it significantly, done fabulous, but
Yeah.
I can't, you know, tell people enough how important it is to eat this diet, and they don't understand why I get so excited like you do.
Especially moms who are listening, we have a responsibility towards our children, future children. So, you know, if you're not eating if you're eating meat and dairy, you're basically not giving your future child the nutrients that the baby needs, and you're basically poisoning them with foods that could cause harm to you, but to them as well. Mm-hmm. You know, I see a lot of moms eating fish and breastfeeding, and they're transferring mercury into their babies. And we know that breast milk transfers mercury. So, you know, there's just so much when you're pregnant. So when people ask me, like, I wish I could turn back time, because when I was pregnant with my son, I was a vegetarian and I wasn't a full whole food plant-based. And I would do anything to go back and be able to eat so clean. But I did what I knew. But now it's interesting, because I tell people and they still do what they've been doing. And I think it's just lack of awareness, and it's not the most popular idea right now, and people just follow the masses. But don't be one of those people. Do your homework and read about it, and make sure that you don't fall into the same trap as most Americans. And absolutely, I mean, I personally think that a lot of autism is linked to dairy, the inflammation that dairy causes. I think, you know, you literally, you know, and so people ask me, well, do you give your son a whole food plant-based diet? I'm like, well, of course I do. You know, I mean, they wonder if I'm afraid to do that. For some reason, it's going to stunt his growth. I'm like, are you kidding me? I mean, he's the one I love the most. I love him more than the entire world put together. So in fact, when it comes to my son, I'm actually even more adamant about him getting a whole food plant-based diet. My son, probably, I don't know, I would say maybe he's had meat maybe once or twice, because when he's with his father, you know, he's, you know, he would eat what they eat. And when he was little and he didn't know the difference, he was tricked into eating meat, and they told him these are vegetarian, and so he ate it. But you know, he basically, when he's with me, he eats a whole food plant-based diet 100%. When he's with his dad, I don't have 100% control over that, so they'll sneak some dairy into his diet, and it makes me very sad. But unfortunately, you know, there's a lot, you know, people don't know. People, there's, the awareness is low, and that's why you and I, Lori, are doing what we're doing, right?
Right.
So one day, moms and you know, dads, they realize how bad this dairy and meat is for their kids, and they stop feeding their kids that.
Right, absolutely. And, you know, there was some really interesting studies with autism and giving children, well, actually they were older, they were 13 to in their early 20s with severe autism, and gave them broccoli sprouts, really high concentration. And what happening is they found in autism, children who had fevers had some remission of some of their symptoms because of the things that are going on in the brain. When you have a high fever, it produces certain, I guess they're proteins or enzymes, something to decrease the inflammation. So what they found is that broccoli, with all of its ITCs and all these amazing anti-inflammatory things that they have, actually does the same thing as if you were to have a fever. So they gave these kids these, I don't know if they were capsules, or I can't go back to look at the study, what they found is regression of symptoms. And, there was this randomized, double-blinded, controlled, whatever study. The thing was, with this RCT, because they had such profound improvements, they knew immediately who was getting the broccoli sprouts and who wasn't. And when they stopped them, they actually regressed and went back and started having the severity of the autism symptoms that they had before. So really interesting stuff. And I think that study came out maybe 2-3 years ago. But it's also on nutritionfacts.org. Dr. Greger has some really good studies or videos on that whole information. But fascinating. You are exactly right.
I just had a patient with autism. That reminds me to make sure I ask them to check out the nutritionfacts.org or listen to your podcast.
Yeah, absolutely. I would say 3/4 to, what did they say? I can't remember the equivalent, but the broccoli sprouts, but it wasn't like it was a tremendous amount to see some regression of those symptoms. I mean, they weren't obviously 100%, but they certainly were improved. So that was amazing. I do have a quick question about your fitness stuff. So what is a normal day for you when you're eating and working out? What, for someone to aspire to be as in amazing shape as you are, especially women in our 40s, right? So everyone's like, oh, I'm premenopausal, or I'm this or that. There's always these excuses. I've had so many children, but that's not the case. So tell me, what do you eat in a normal day, your exercise regimen, just kind of give us an idea.
Oh, sure. Okay, so I love fitness. Those of you who want to get into a fitness routine, I would say, do what makes your heart happy. Some people think, oh, I have to lift weights or I have to do yoga. And, it's not necessarily what type of workout you're doing. It's just as long as you're doing something and you're moving and you're getting your heart rate up and engaging your muscles, that's all you need. And, if you have a good diet, even a short duration of an exercise plan helps. My secret, I look like I spend hours at the gym. I mean, when you look at my pictures, I'm ripped, right? I mean, I look muscular and I look like my body fat percentage is low. But, I don't. I spend only 25 minutes to 30 minutes time at the gym. So my secret is my diet. You cannot outrun bad calories and you cannot out-exercise bad calories. So when you eat really poorly, what you're doing is you're basically, you're just putting all the bad calories into your body. That converts to fat, and you would have to run 13 miles to get rid of it. So whenever you're working out, my suggestion would be, number one, to do something you love, but don't do it to burn out bad calories. I think fitness is important, but what I call it, the Dr. Angie trifecta, I think 80% is nutrition. Okay, so good diet is the most important thing for health and for fitness. And if you're eating a whole food plant-based diet, it takes a very, 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 very minimal amount of time at the gym to achieve incredible results. Mm-hmm. I'm a busy doctor. I run a practice. I'm involved in 50 different projects, loving my life, having a great time, but I'm busy. I don't have time to spend an hour or 2 hours at the gym. I just get in and out. I put my timer on 25 minutes, and when it rings, I get the hell out of there because I don't really want to hang out over there. I love the gym, but I don't really want to hang out. I'd rather come home and see my baby. So what I would say is it's not how long you work out, it's the quality of the workout that matters and how much you love it and how much you're into it. So if it's walking, then walk. If it's ballet, then do ballet. If it's basketball, then do basketball. Whatever it is, it's just something that is sustainable, right? So I see people doing these heroic workouts when they're 20s and 30s. Well, the muscles may be able to handle all that, but the joints don't. So make sure whatever you're choosing is sustainable. That I plan to be 105 years old with this diet that I'm eating. So I'm thinking, okay, what can I do at the gym that I could carry on when I'm 105? And so I figured weightlifting is the one for me. Number one, I love it. It's convenient. I could do it rain or shine, and I can do just 25 minutes and I'm done. I'm like, okay, that's it. So I go every single day, okay? And like I said, just 25 minutes. I listen to music. I get all into it. and I lift weights, and I'm not a hero at the gym. I just basically do what I can without injuring myself, and everything I'm doing, I will be able to carry on in my old age, just less weight, right? Perhaps, maybe not. Maybe I'll be the oddball who's like lifting heavier at age 105, but you never know. So yeah, that's it. So it has to be, number one, sustainable. Number two, short duration, so you don't, give up. If you have a New Year's resolution and you say, "Oh, I'm going to work out 2 hours a day every day," and you've never done that, most likely you're going to fail, because you don't. There is a reason you weren't working out that long to begin with. That's unreasonable for most of us with jobs and kids, right? So be reasonable about the goals. When I go to the gym, I separate. Sorry about that. I had a call come in. Sorry about that. I try to separate. I have a very bodybuilding attitude when it comes to workouts, and that's not necessarily good or bad. It's just I like the brain-muscle connection, and I like to focus on one muscle at a time. So on Mondays, I would go to the gym and work out shoulders and abs. And that's my routine. And because I only have 25 minutes, I work out the shoulders, and when it burns out, I go to the abs, no rest. And then I burn out the abs, then I go to shoulders, and then abs, shoulder, abs, shoulder, abs, shoulder until 25 minutes, and then I leave. The next day I do chest and biceps. I focus on those two muscle groups, and I go back and forth until I burn those out. And then I do back end triceps, and then I do legs. And I do 2 days of legs. I do hamstrings, and quads, and then I separate the glutes a little bit, just because nowadays it's the fashion to work on the glutes. So I have a very bodybuilding attitude towards it, because I know I'm not going to get hurt doing weightlifting, because I do it cautiously, and I know a lot about anatomy, and so it helps me to focus on each muscle group and build that mind-body connection. But yeah, so fitness is great, but if you want to look good, don't go to the gym. Don't go to the gym to lose weight and look good. Go to the gym to be strong, to maintain muscle mass, to get energy. Yeah, to look good too, but 80% of it is done in the kitchen, not at the gym. So that would be my advice to anyone who's listening.
That's perfect. And I would say you're actually right. Do something that you will continue to keep doing, right? So if that's weightlifting, if that's even calisthenics or running or walking, like you said, swimming, there's so many great activities that we can do and safely. And, I think I'm always impressed with people who do these ultra marathons and stuff, but I don't have fun training past a half marathon. I've done a full marathon, but it's just not fun. And I love running. Like I love running, but why? Why would I run for 4? That's just me. There may be others who do that stuff, but I think it's fabulous, but I couldn't do it myself. But that's fantastic. So awesome. So if someone is wanting to see you, you're in California, where should they go to say, "Hey, I need help with this. I need to go see Dr. Angie"?
Sure. The best way to come see me in my clinic, go on my website to get the phone number to make an appointment, www.drangiehealth.com. So www.drangiehealth.com.
And I'll put all the links too in the show notes. But go ahead. I'm sorry.
Oh, and my Instagram has my office information as well, and it's angie.sadeghi.
Great. And we'll also put those links too. So Dr. Angie Sadeghi, thank you so much for spending so much time with us. But I just want to ask one last question. Is there any advice that you could give to someone who's considering doing this, but they're still hinging, even though everything you just said was, a million reasons to do this? Was there, or how to start? Is there any one little bit of advice that you've seen that just help people really just take off and do this?
Yes, I understand that sometimes it can be hard because old habits are difficult to break. Even though sometimes what's right, it doesn't mean that it's easily, you can easily transition yourself out. So what I would say is, for those who can't do this overnight and they're hesitant, they don't know what to eat, or whatever the reason may be, start crowding out the bad stuff. Okay, and I always categorize it for my patients. Okay. dairy is the biggest poison in my opinion. I don't know if there's studies done on dairy versus meat versus processed meat. I don't know, but I would say dairy is poison. Stop eating dairy today. Okay, so that's the first thing you should do. Give it a couple of months, and then you're in your new routine of not eating dairy. Then what you want to do is give up processed meats because they're carcinogenic, right? So then, all you're eating at this time is fish, steak, and chicken, or whatever seafood you're eating. Then what you want to do is study helpful websites and read helpful books. There are so many good books like Forks Over Knives, Dr. Greger's How Not to Die, tons and tons of recipes from really awesome altruistic nutritionists, dietitians, and chefs who are just trying to help, right? They're putting wonderful recipes out there. Start getting into finding out how you could replace that meat with wonderful ingredients like tempeh, which has equal amounts of protein to chicken, except it has good, it gives you good gut bacteria because it's fermented soy, and it's healthy for you. Things like tofu, there are Beyond Burger, Beyond Meat products out there you could substitute the meat with, or don't even substitute at all. But I understand it can be difficult at first. But once you've given up the dairy and you're used to it, then you're giving up the processed meat, then you're giving up all the meat. But in the meanwhile, you're studying what you can replace into your diet. And so slowly transition into a whole food plant-based diet and slowly crowd out the bad stuff. And that may be helpful.
Cool. That's fabulous advice. Absolutely. Just bring in the good and eventually the bad will leave too. So fabulous. But I agree. I think dairy is by far the first thing people should eliminate. By far. Perfect. Well, thanks again for your time. And I am so thankful that you were willing to let me interview you. And I'm so excited to see where your future takes you.
Well, thank you, Lori. It was a pleasure talking to you. I really appreciate it.
No problem.
Keep on